Well, our next speaker probably needs no introduction, but yes, I am more than honored to give her the introduction. Just give me a moment. Our next speaker is Dr. Ruhi Agarwala, who is very, very passionate about functional medicine, is also a part of the functional medicine world, the conference as well, and has been passionately participating today as well. So, with that, just allow me to introduce you first. Dr. Ruhi Agrawala is basically a pioneering functional medicine practitioner, and she's also the co-founder of the Functional Medicine Clinic. She's renowned for her expertise in autoimmune conditions, women's health, and gut health. And today, she will be sharing valuable insights on supporting gut health during cancer treatment. So, please welcome Dr. Ruhi Agrawala. Thank you so much for taking out your precious time, Dr. Agrawala. How are you doing?
I'm doing great, Amarjit, and wonderful hosting. And thanks for the kind words.
Sure, you may share a screen. I'll move away from the screen.
So, very good afternoon, everyone. I'm sure there has already been a lot of information for all of you to grasp, and I'll share my bit in this entire conference where where I want to shed some light on some of the overlooked aspect that when it comes to cancer treatment. So when someone is undergoing chemotherapy or radiation therapy, often you will see that that individual is struggling with digesting food. There is a lot of gastrointestinal toxicity, which actually not just affects the treatment that that individual is undergoing, but also, just does not motivate that individual to continue the treatment, and the effects of that toxicity continues to be even post treatment as well. Often we have seen an individual who's diagnosed with cancer, the diagnosis itself takes so much of toll for that person, and then the treatment can be very intensive. And then of course, the toll that the treatment itself takes on the body, and the adverse effects can be even more. So it's very important that we support the body enough so that we can make that journey um, easier for that person. And one of the important area that needs focus is the gut health, because the damage of the chemotherapy and the radiation can be huge. It can range from just mild diarrhea, stomach pain, vomiting, nausea, to even severe colitis. So we see a lot of motility disorders. The GDF15 is affected. We see the leaky gut. The leaky gut, because of which you will see a lot of dysbiosis, a lot of immune system dysregulation happens in that individual. The person can struggle with chronic diarrhea, which just continues even after the treatment has been completed. And this can, just the fact that the person is struggling with chronic diarrhea, you can imagine um, what that individual is undergoing, apart from the cancer diagnosis itself. So it's very, very important that we identify what is not okay, what is the damage, and give enough support. So these are just, as I mentioned, some of the digestive issues that one can experience, from diarrhea to altered microflora. There can be candida overgrowth, colitis, constipation, acidity. The person starts experiencing a lot of food allergies, um, gastrointestinal mucositis, IBS, IBD can come in. A lot of malabsorption, a lot of you'll see a lot of oral ulcers, mouth sores, stomatitis, etc. So if we talk about the leaky gut, right, the chemotherapy, the radiation can damage the intestinal lining. So as you can see in the image, the lining in the gut, it's there are tight junctions which regulate the exchange of anything across the junction. So the toxins, the infections, etc., do not get way into the bloodstream. But when these tight junctions are damaged because of the toxicity of the ongoing treatment, it can then just allow anything into the system. And then once the toxins, infections, the waste, they find their way into the bloodstream, they can just dysregulate the immune system. So hence, it's very important that we do not allow this to happen. Moreover, it just not starts in the gut, but then in the oral mucosa itself, the damage can start. And here, the dislocation of the oral microbiota can happen, which again can be a cause of various dysbiosis in the gut. The digestion in the digestion that can happen in the oral cavity, that can be disrupted. The epithelium can be broken down, and of course all of these sends out systemic immune responses. So it's not just the leaky gut, but then it's also a lot that is happening in the oral mucosa. So overall, the damage that the entire GI system undergoes, that affects the individual's ability to digest, absorb, assimilate nutrients, right? And overall, it is impacting the systemic healing of that individual. So it's very, very imperative that we focus on this during the cancer treatment. What we are looking for, what we have to look for is actually move that individual um, condition from a disrupted gut barrier to bring back the mucosal integrity. The bacterial diversity is reduced, so we have to bring back the bacterial diversity, reduce the pro-inflammatory cytokines, reduce the oxidative stress. With the leaky gut, all the LPS translocation, the infections have found its way. So we have to seal the leaky gut, bring down the treatment-induced toxicity, and of course prevent the GI complications. And we know enough that the gut and the brain is connected. So the anxiety and the stress can be really heightened with this GI damage. So it's very, very important that this is taken care, so that we can bring down the anxiety and the stress, which will again help a lot in the recovery process. And with a systemic holistic approach using the principles of functional medicine, it's very, very possible to bring back and restore the gut health. So if we look at the framework, you will see there are four-hour framework, 5-hour framework, 6-hour framework. So I have put here a 6-hour framework by the Functional Alliance. But again, what is more important is that whatever is needed is done. So one is you remove the instigators, you replace what is missing, you also re-enucleate the good bacteria, you work on repairing the gut lining, and then you maintain that balance and regulate it. So if you look at the first step, which is removing the triggers and the infections, what do you have to remove? The first and the foremost is remove everything that can be inflammatory. And basics are remove gluten, remove dairy. It should not be like, okay, once in a week you give that individual gluten. No, because that once in a week stays there for 45 days in your body. So it has to be a complete elimination of gluten, dairy, processed sugar. Identify other potential allergens. It can be a seafood, it can be eggs. So try to identify what the body is saying no to. All genetically modified food should be out of the diet. And then it's important to work on the infections. Of course, working on the infections doesn't have to be the first step, but then it's very important that you identify those infections. It can be bacterial infections, they can be parasites, they can be. Dr. Thomas Lodhi, he spoke a lot about the parasites and what can be done for parasitic infections. So they can be Candida overgrowth, they can be viral infections. So identify these with the help of some detailed investigations. It can be a comprehensive stool test. Take the help of an organic acid test. Identify these so that in the due course you can work on them. You can use a combination of herbal or pharmaceutical combination based on the availability and what is really needed for that individual. Then it's very important that you replace whatever is lost because of the damage. A lot of nutrients is lost, of course, and a lot of body's ability to produce to support the gut health is lost. So make sure that you're supporting enough with bile salts if that's needed, digestive enzymes. The individual may be low on stomach acid production, so supplement with betaine, HCl, and of course, some very easy to absorb nutrients, which can be a complete B complex, vitamin D, basic minerals, magnesium, zinc, omega 3 fatty acid, very, very important, and of course, amino acids. Now, when it comes to repair and regenerate, so we have to seal the leaky gut. We have to bring back that mucosal integrity. So, some of the basic requirements are some of the basic supplements, nutrients that's needed would be L-glutamine. It's very important for healthy intestinal gut lining, and you can start with 2 to 4 grams, but then in case of cancer cases, you'll need much higher. So it will rate somewhere between 10 to 4, depending on the how critical that individual is. MSM, quercetin, they are known for their anti-inflammatory nature. And acetylglucosan will again protect the mucosal lining from the damage. Mucin is a glycoprotein which is normally produced by the intestinal cells and it protects the intestinal lining, but because of the damage, this may not be produced enough. So it may be good to support the intestine with this. Aloe vera, DGL, slippery elm, marshmallow, chamomile, cat's claw. These are all known for their soothing effect on the GI lining, and it really helps in supporting the individual during this journey. Zinc carnosine is a peptide actually, and so it helps in strengthening the GI barrier, strengthening the tight junctions. Another very important thing is colostrum. Colostrum from grass-fed cows would be they you should go for grass-fed cows. It has growth factors like IGF-1 and TGF-beta, which will help in repairing the intestinal lining. The immunoglobulins in colostrum, they can neutralize the pathogens and the toxins. And of course, it also has PRPs and lactoferrins, which have anti-inflammatory effects. So couple of these nutrients will help in restoring the gut integrity. What we use in our practice is a hydrolyzed vegan protein. Because the colostrum can add a lot of value to this recovery process, we started working on creating a product which has colostrum along with other nutrients. Now, it's important to reestablish the gut microbiota. So, using certain known probiotic strains is very, very important. And again, it does not have to be the fourth step in the gut healing process. Many of these steps go hand in hand. So, it's very important that you personalize, you strategize the protocol for your client. And it's important that you provide strains which are normally found in the human gut. And so you can, a soil based probiotic is spore based, also known as spore based probiotic. It's the safest and to be given to such cases. This would include Bacillus coagulans, Satilis, Closi, and Lechinformis. Another good probiotic supplement to add would be Saccharomyces boulardii, which will, of course, help with the recurrent diarrhea and also support in the Clostridia infection if there is. If that individual also has IBD, then of course VSL3 would be a good supplement, a good probiotic to add. You can also add probiotic rich food. However, it's important to be very careful when adding raw fermented food, because if there are infections, if there are gut infections, then adding raw fermented food can backfire. So in that case, you go with the known strains of probiotics and let the infections clear, and later you can introduce probiotic rich foods like kefir, sauerkraut, kimchi, etc. And of course, we cannot ignore prebiotics, which are the fertilizer for the existing gut microbiota. And for this, you have to include variety of vegetables and fruits in the diet. They have to be the plate has to be a colorful rainbow diet. So that's the basic, and it's very very important. Another very good prebiotic to add would be a variety of millets if the individual can digest. Different millets provide different nutrients and different kind of fiber. So if the individual can digest, that is definitely it's definitely good to provide millets on a rotational basis. And lastly, once you see the gut is healing, then you can try reintroducing. Of course, I still do not recommend reintroducing, but then based on how good that individual is, how the recovery has been, then you can decide it for your clients. You can try reintroducing wheat and dairy and see if they are responding, how their body is responding. Otherwise, it's just good to keep it at bay. And you will need to continue the support with vital supplements to support the gut health and regulate the immune system. So basics like B complex, vitamin D, omega 3 amino acids have to continue. Now, just to dive deeper into different kinds of diets, there are various kind of diets: elemental diet, GAPS diet, low food maps, autoimmune protocol, ketogenic AIP diet. In the interest of time, I would want to dive deeper into one kind of diet, which is the elemental diet. It basically refers to a kind of diet which allows the individual easy digestion. On one hand, it's rich in nutrient-rich foods, and it's designed in a way that it does not add more stress to the existing affected digestive system, but at the same time, it maximizes nutrient absorption. So these are some of the benefits of elemental diet. Of course, you see an improved digestion because you've eliminated the complex food. It relieves the digestive system of the process of digestion. So the digestive stress and inflammation is low. The nutrient absorption is very high because whatever nutrients you are providing, they are in the form that can be very easily absorbed. The gut inflammation will come down. So symptoms of IBS, Crohn's, and other gut disorders, you'll see them being alleviated. The gut healing will happen. The leaky gut will start getting repaired. The gut microbiota will start diversifying. As the gut health improves, you will see the immune system settling down. The immune system will get regulated, and of course, the gut dysbiosis will reduce. The pathogenic strains are starved. With the gut brain axis, you also see an improvement in the mental clarity. You see a lot of improvement in the mental health of that individual. And not to mention, the oxidative stress is reduced. Now, what is the core principle of an elemental diet? You're removing all the solid foods, and especially here, of course, all the food that is high in fiber is removed. All kind of sugar in any form is removed, and all unhealthy fats are removed. And what are you replacing this with? You're replacing this with core elemental nutrients. One is amino acid, glycine, and glutamine, etc. You're providing short chain fatty acids in the form of collagen peptides. You're providing electrolytes. You make sure there is electro balance. All the vitamins and minerals that is important for the healing, and of course the omega-3 fatty acids. The different kinds of elemental diet. One is a full elemental diet where you are only providing the elemental nutrients for a period of, one can choose between 1 to 4 weeks. Then there is a semi-elemental diet where you have elemental nutrients plus you're also giving some solid foods. Many times it's difficult for an individual to just be on a full elemental diet. So semi-elemental diet is a very good diet to allow the healing and at the same time improve the compliance of the individual. And then there's a third option where you have a cyclic elemental diet where you're alternating between elemental diet and the solid foods. This is also a good way in our practice. we start with a semi-elemental diet, and then at times also alternate with a cyclical elemental diet. So the idea is that we are starving the bacteria of all the unhealthy food that the person may be consuming by replacing meals for 2 to 4 weeks. And what are we giving in return? I mean, what are we alternate swapping it with? We are swapping it with elemental formula, which should be a hydrolyzed protein. Now, why should it be a hydrolyzed protein? Because if you're giving protein which is not easier to digest, you are adding digestive stress to the body. So it's very, very important that whichever protein you are adding to the diet, it is in a form which can be easily digested. So an elemental formula is powdered nutrients in a pre-digested form, and it should be high in amino acids, and then you can add various sources of healthy fats and vitamins and minerals. It's very important to take care that while you put someone on a elemental or a semi-elemental diet, you ensure that there is a proper nutrient balance. If you are not taking care of this, you may end up, there can be a lot of nutrient imbalances in that individual. So please ensure that this is taken care. Monitor the electrolyte levels. And initially, there can be some gastrointestinal issues, which can be for a short time. And because the GI tract is just adapting to this new diet, and in case any support is needed, it's always wise to consult with a healthcare professional. Now, I want to show you the semi-elemental diet that we use in our practice in in functional medicine clinic. So, what we do is we ask the individual to replace the meals with a recommended protein shake. And it may not be easy for someone to completely eliminate the regular diet. So we do it in a phase wise manner. So if an individual is taking 3 meals, we ask them to replace one meal with this protein shake. Then they replace 2 meals with this protein shake, and then they completely transition into to the protein shake, hence eliminating the solid food completely. Now, what is this protein shake made of? So you take a glass of sun-charged water. Why sun-charged water? Because the water otherwise that we get from RO is dead water. So when you keep it in the sun for at least 3 hours in a transparent container, it gets sun charged, it gets structured, and that's the kind of water our body wants. So take a glass of sun charged water, and to this you add 25 grams of hydrolyzed protein powder. I have mentioned the vegan protein powder because vegan, again, will ensure that it's hypoallergenic and it's easy to digest. You can start with lower doses and then gradually increase. Add a tablespoon of cold pressed flaxseed oil, and you can add a colostrum based supplement to support the leaky gut. And right now we are not using this because it's not ready yet. And so this protein shake can be taken 3 4 times a day based on the appetite or the hunger that the individual feels. What are the other things you can take during the semi-elemental diet? One is the fresh juice. It's not a fruit juice. It has to be 80% veggies. It's best to use a cold pressed juicer to make this juice. Then you can also take apple stew. So just take an organic red apple and boil it with some cinnamon powder. Let it cook, and then you consume this. This has pectin, and it is wonderful for gut healing. Restrict the fruits which are sweet and high glycemic index. Go with these selected fruits. And other things that can be taken during a semi-elemental diet can be saute veggies, boiled vegetables, a vegetable or a bone broth. When you do this, you're not feeding the pathogenic bacteria, etc. You're not feeding the fungus in your digestive system. They will starve and the infections will die off. Second, you are not uh, adding stress to your digestive system. So the digestive system will rest, and that will allow the healing to happen. We cannot keep feeding the body and expect the feeding to happen. So it needs rest. And semi elemental diet is a wonderful way to do that. Outcome will definitely be balanced gut microbiota, a regulated immune system, the inflammation will come down, the proliferation will be modulated, apoptosis will be there. So, this is what the outcome would be when you are supporting the gut health during the treatment process. And if I can just take a minute here, of course, we focus on a lot big things during the treatment for cancer. But if we just have to simplify, we have to maximize what our body needs, right? All the raw material it needs: oxygen, sunlight, water, all vitamins, minerals, fats, protein, etc. And a strong belief that we can recover. We have to remove everything that is toxic, all kind of toxins, infections, allergens, stress, any emotional trauma that has to be worked upon, all limiting beliefs, etc. And of course, prioritize an environment that will support in the healing process. You have to take care of your physical activity, take care of the breathing, take care of the relationships that you maintain, and of course, above all of this, positive visualization works. It really works. So this is very important that we also need to tell our clients to do positive visualizations. So with that, thank you so much.
Thank you so much, Dr. Ruhi. Again, another wonderfully actionable insights given by you. I'm pretty sure everyone enjoyed the elemental diet that you had actually explained and given so many actionable things to do. And no doubt about it, I think the positivity is only increasing in the audience, and they have been enjoying since morning. So thank you so much once again. I'll just take one question which I could see. Uh, there was a question from Sivaram in the audience. He says, "Hi, Dr. Ruhi. I understand in the West, L. reuteri is increasingly missing in their microbiota, but has a very valuable role to play. What are your thoughts on this, and what might be the state in India and its sources to replenish?"
So it's all, even in our practice, we see that supporting the gut microbiota with L-reuteri definitely helps, and we do have certain supplements also available that can support providing these strains.
So thank you. Thank you so much for your insights, Dr. Ruhi, once again. Thank you so much.